Hello, everyone. My name is James Hardy, and I'm excited to talk to you about the career of an exercise physiologist. This field is an intersection of science and health fitness. It plays a vital role in helping people recover from injuries, manage chronic conditions, and improve overall well being. Today, I'll be walking you through everything from what they do to how they become one, and even how this connects to what we've been learning throughout the world about exercise science and just our overall physical health. What is an exercise physiologist? Exercise physiologists specialize in how the body responds to physical activity. They apply this knowledge to help patients recover from conditions like heart attacks or chronic illness. These professionals create customized workout programs based on the patient's specific needs. So that's where you get into rehab programs and personal training programs and different things like that. They often use scientific methods and tools like stress tests and VO2 max testing, range of motion of certain limbs. Depending on the setting, they may be called clinical exercise specialists, especially when working in hospital or cardiac rehab units, which are clinical settings. Their core responsibility is to assess a person's physical health and prescribe exercise to improve their conditions. This includes measuring oxygen usage, heart rate, blood pressure, and lung capacity. They monitor the client's progress, adjusting programs over time, which is where I talked to you about the rehab programs and the exercise programs, right? Those programs are tailored depending on where the patient is and how they're increasing or evolving with their injuries. In clinical settings, they might work alongside cardiologists, physical therapists, or nurses. Education requirements. All right, so to enter this field, you'll typically need a bachelor's degree in exercise science or kinesiology or related fields due to the fact that a lot of these majors take similar courses to establish a foundation for entering exercise to, to become an exercise physiologist. A master's degree is often required for clinical or research positions. Now, to be competitive for some of these graduate programs, many require a minimum of 3.0 GPA, but I've seen some that went as high as 3.5, 3.6 just to be competitive to get into some of these master programs for to be an exercise physiologist. Also, during your studies, you can expect to take classes like human anatomy, exercise, physiology, motor learning, and biomechanics, which are some of those classes that I told you, like majoring in exercise physiology and kinesiology. They take a lot of these similar courses to have a decent foundation. Lab work is also critical because it gives hands-on experience measuring health indicators like metabolic rate and heart rate under physical stress. All right, let's talk about these education costs. Tuition for a bachelor degree ranges from 30,000 to over 100,000, depending on whether you attend a public or a private school. Private schools, I notice, are more on the higher side, closer to the 100,000. A master's degree can add another 20,000 to $60,000 on to what you have already paid for your bachelor's degree. And I've seen some master programs go up to somewhere around like $80,000, right? Just because of the private school or those schools being well known. Fortunately, there are many financial aid options available. Organizations like the American College of Sports Medicine and National Strength and Conditioning Association offer scholarships also. Graduate assistantships can offset costs and give valuable work experience, which is what is needed in this, right? Getting those hours needed. You can also apply for FAFSA, like local scholarships and school specific aid, right? These things are just to help out because this degree can get pretty expensive. Experience and certifications. So getting those clinical internships or hands-on lab experience are often required to graduate and get hired, right? They love those hands-on or clinical hours. Clinical hours are real big in this field, right? You need to be able to have experience of dealing with different clients and different patients that have certain pains, right? And just to be in that atmosphere. Interning at a hospital or a sports medicine clinic is a great way to build your skills. Certifications are very essential in this field, definitely very essential. So you have the ASCM, Tax CEP, or the EP Tax C certifications, right? Those are two certifications that are needed. The most respected ones come from the American College of Sports Medicine, such as the Certified Exercise Physiologist, ACSM, EP, Tax C, which is what I was talking about, or Clinical Experience Soc Physiologist, which is the ACSM Tech CEP. Most jobs also require your CPR certification and your AED certification. Like many health professions, continuing education units, right? You need to be able to attend some of these conferences to get more education to make sure that you're staying up on all the latest research that is being done. CEUs are necessary to maintain certification. Usually every 3 years is what you do some of these CEUs, which is going to some of these conferences and attending, to get more experience and find out about the latest research. You get papers that are wrote about different research that's been done for different patient problems or pains or clinical problems that patients have. And so it's real good to go to some of these. You have to. Exercise physiologists generally work full time, right? 9 to 5, 8 to 4, 8 to 6. Sometimes it goes over. If you're in a hospital or rehab center, you'll likely work standard daytime hours, Monday through Friday, 9 to 5. In sports or private fitness settings, the schedule might include early mornings or evenings to match client availability, right? You may have clients at 5, 6 o'clock, especially if you're doing your own business or you're private contracting with somebody, like especially in the military, which is what I've seen from my previous experience of dealing with exercise physiologists. I see that a lot of them have work to 5 and 6 because a lot of us didn't get off work until after 5. So, they would come in later or they would do paperwork first, then start their times normally around 12 o'clock. Entry level salaries average between 45 to $55,000 per year. With experience and certifications and also your master's degree, that number can rise to over 80 to $90,000 a year, sometimes more so on the upward 120,000. It's typically a salary position, but some may be paid hourly, especially if working in smaller clinics or part-time. If you're interested in this field but want to explore the options, there are several closely related careers. Physical therapists focus more on injury recovery, right? So you see how that's relate to injury recovery, right? So exercise physiologists deal with chronic pain and chronic illness, right? So there's different avenues that they have, right? They may have a point A, which is pre-injury, right? Before the injury, right? So you're working on your body to keep yourself from getting injured. Then you have B, which is during the injury, right? What are you supposed to do? Then you have C, which is recovering from the injury. Athletic trainers work with sports teams and individual athletes to prevent injuries and enhance performance. once again goes to A, right? Pre-injury, right? Building the muscles, building the body up to keep it from getting injured or to make it easier. So after you become injured, right, that those muscles are already strong. The body is already strong, which makes your recovery a lot more smoother. Personal trainers don't usually require a degree, but focus on fitness and health in gyms, right? Strength and conditioning coaches are common in collegiate and professional sports, right? Strength and conditioning, that's more so around A, and some go towards C, which is post and pre, right? Post and pre, strength and conditioning, right? Strengthening and conditioning to keep from being injured, strengthening and conditioning after you've been injured and you're recovering from it due to whether you've had to have surgery or just haven't had downtime to allow your body to heal. Okay, so job outlooks and trends, right? According to the Bureau of Labor Statistics, the demand of exercise physiologists is expected to grow around 10% by 2032. That's faster than average of all occupations, right? So this is a growing field. People will always, as humans, right, we will never be healthy our whole lives, right? You will go through certain things just because that's the body, and there's still research being done on different illnesses that just turn up, right? So you will always need, especially in this medical field, right, exercise physiologists, because they incorporate your personal trainer, your strength and conditioning coach, your exercise scientist. It covers all of that. This growth is largely due to rising awareness of preventive healthcare and the need for cardiac rehabilitation in an aging population. Humans, we age. There's a growing focus on lifestyle medicine using diet, exercise, stress management instead of medication, right? I noticed that's during my research during this, I started to notice that a lot of research is going more towards not using medication, right? Allowing the body to heal, putting the body in different circumstances to allow for it to heal itself without needing to digest or intake some type of medication. Course connections, right? A lot of what we learn in our exercise science class ties directly to this career. Motor behavior, for instance, helps explain how people relearn to move after injuries. Myself, I had a ankle injury that I was pretty bad, and I had to learn how to walk again, right? That falls into motor behavior. Clinical exercise physiology gives insight into how exercise impacts the cardiovascular and respiratory systems. Critical knowledge for working with cardiac and pulmonary patients is very essential. Biomechanics helps analyze movement patterns to prevent injuries and improve performance. All these subjects combine in real life settings where exercise physiologists help people regain mobility, improve endurance, and live much, much healthier lives. For this presentation, I use resources like the American College of Sports Medicine, the National Strength and Conditioning Association, the Bureau of Labor Statistics. I also reviewed job postings, right? This was real key. I also reviewed job postings and career guidelines from the Mayo Clinic to understand day-to-day expectations of this role. I also attended a clinic known as the Atlanta Sports Recovery. Now, in attending this clinic, I was a patient there, but I also did research there just to find out more about it because they, a lot of these personal trainers, occupational therapists, physical therapists majoring in exercise science. So they have a very extensive background from bachelor's degree to master's degree dealing with exercise science and possibly some dealing with exercise physiologists. At one point, there was an exercise physiologist that came from another location just to give my personal trainer some information, right? They did like a class, so that was pretty neat to be there and watch for that. But this is overall my presentation on becoming an exercise physiologist. Thank you.